يا مرحبا زين الشهور.
Assalamu alaikum viewers, welcome to yet another edition of Ramadan and Health. In the studios with me today I have Dr. Azadie to throw more light on the issue of fasting and breastfeeding. Welcome, Dr. Azadie.
I'm delighted to be back in your program, and this is a kind of continuation of breastfeeding and fasting during the Ramadan. If you remember, last week we discussed about the fasting during the pregnancy. Now we are coming to the other phase of the after delivery, and after delivery is the breastfeeding. So breastfeeding is the time when mother breastfeed the baby from the very first hour, possibly when she has delivered the baby. It is whatever the baby gets from the mother at very minute start breastfeeding. It is such an important substance for the baby to get a bit stronger immune system, and also make the baby quite strong even in the first few weeks. Now, a mother who breastfeeds the baby, it has to be herself healthy, good nutrition, so that whatever she supplies to the very newly born baby to be breastfed, and all those vitamins, ions, and all those substances, which is tremendously important for the baby to transfer to the baby. Now, if a mother during that time, during breastfeeding, decide to fast, we suggest probably she should postpone it for the time when she the baby is already about 3 months time. Why? Because breastfeeding itself is quite a bit of stress for the mother. She just delivered from delivering the baby. Now is the phase when she has to give so much of important substance to her baby. So we definitely do not recommend breastfeed mothers to start fasting. Now, if they push it too hard and they are very healthy, with healthy food, healthy nutrition, they can eventually breastfeed maybe 1 or 2 days a week, but not longer than that. But actually, it's better not to do it, because during the not eating by this heat of for many hours, 10, 14 hours not eating and drinking, it can affect actually the quality of the milk passing on to the baby. So rather not to do it. And the baby has to get all those substances for the first 3 months to become with a stronger immune system and get healthy. This is a very crucial, a very important time for the baby to have good nutrition, and no one else actually can give this baby rather than the mother herself. Why? Because it's a natural milk directly from the mother. It goes to the baby as taking it. So, but there are some patients, even they have suffered a lot during the pregnancy, and they have had a high blood pressure, possibly they have a kind of diabetic, and those kind of disease which sometimes come during the pregnancy, for which we will have an addition to discuss about it. Those are definitely at risk. If the patient is anemic and breastfeeding, if the patient had a high blood pressure and breastfeeding, if the patient had a diabetes and breastfeeding, we definitely recommend any kind of this disease which they can affect the mother and of course the baby not to breastfeed. So I hope that your people watching GRTS getting this message and pass it on to other women, so that they will avoid to do this. Fortunately, in our culture, in African culture, Asian culture, the mother breastfeeds the baby, and the milk of the mother is actually nothing in the whole world can replace the mother's milk. because mother's milk is a totally naturally, and all with those supplement, which is, so we do not recommend to start with the artificial milk to go to the baby and to get to fasting because I cannot breastfeed. It happened. That's to say, I want to fast, so I give some artificial milk to my baby. If they do that, the baby actually, it get used to it. It get used to it, and then when the mother, after 1 month of fasting and start breastfeeding to baby, the baby cannot even not to take the mother's milk. So we know for generation that nothing in the whole world can replace mother's milk with all those absolutely natural supplement to give it to the baby, for the baby to develop, and then to baby and get a healthy baby, because those times are most important time.
Thank you so much, Dr. Azadie, and I hope the breastfeeding mothers have learned a lot from today's topic. Till we come your way next week, inshallah, Ramadan Mubarak.
يا مرحبا زين الشهور